Welcome back, guys, to AA Twins Club, and I just want to very quickly go over how often you should be visiting your dentist. I know there are people that just wait until they have toothache and then they go to the dentist, which is a very big no-no. You shouldn't be doing that. Some people go by their insurance benefits. So if it's twice a year benefit, then they go twice a year. And then some people just never went to the dentist. I have patients that were 50, 60 years old or even older that it was their first visit coming to the dentist at that age. So there's a lot of unawareness. The importance of going to the dentist regularly is an important part of your overall health. So the recommendation, the ADA recommends that you should visit your dentist every 6 months for routine checkup and also for regular cleaning. That's twice a year. And then, once a year you might get some x-rays done as needed, but definitely twice a year regular cleaning. Now, this every 6 months is for individuals that have healthy gums, healthy teeth, and they have really good diet, good home care. They're brushing regularly, flossing religiously, and everything's pretty much under control. So that's more of a preventative care. They come every 6 months. If you fall into that category. And also we do definitely oral cancer exam. So when we come in every 6 months, we definitely check all the soft tissues and all the hard tissues to make sure there is no signs of oral cancer. But the other category is coming in more often. 6 months is way too long for some patients. So I have a lot of patients that I have put on every 3 to 4 months. I see them every 3 months or every 4 months for their periodontal maintenance cleaning. And those are patients at high risk. High risk either because they have moderate to advanced gum disease or they have high risk for decay. So if you're a smoker or you drink, definitely that puts you at high risk for oral cancer. So you definitely want to see your dentist regularly for the oral cancer exam. And also gum disease, tooth decay, high risk, disorder of jaw joints, or if you have any systemic diseases, all those will put you at high risk, and you would definitely want to see your dentist or a hygienist every 3 to 4 months. Now, another category would be diabetes, which is very common nowadays. Type 1 or type 2 diabetes definitely affects the mouth, especially with the gum disease, because if you have uncontrolled diabetes, that means you can have high risk for having gum disease and vice versa. A lot of people are on so much prescription medication nowadays, and one of the common side effects from those medications is xerostomia, which is dry mouth. The blood pressure medications, the beta blockers, calcium channel blockers, the diuretics, all of those medications, the side effect is dry mouth. Antidepressant medications, acid reflux causing tooth erosion. So all of those, or I would just say majority of the medications that are out there right now, prescription medications, they have the side effect of dry mouth, which is the biggest problem right now, because dry mouth will put you at high risk for getting tooth decay. And then also just the dry mouth, dealing with that is very uncomfortable. All the tissues are really dry. Chewing and swallowing or even speaking, all those can become a problem. Going through any kind of radiation treatment that will give you xerostomia because it affects the salivary glands in the mouth, and especially if you're getting radiation for the head and neck area. So again, you want to definitely see your dentist more often during that period, because it will bring a lot of changes, not just to your whole body, but to your mouth especially as well. People with just poor diet, especially teenagers, taking excessive amount of sugar, beverages that are acidic, and especially all those sports drink with high amount of sugar, and then having poor hygiene, they're at very high risk for tooth decay. So definitely, all these categories will put you in 3 to 4 month maintenance appointments to make sure that we detect the problems early on, so that you don't have to fall into the major problems like root canal or gum disease, and then it definitely is more costly and takes more time. So, and then of course you get that dental phobia because you go through so much work. So try to focus more on the preventative care, coming more often. The least would be every 6 months, which majority of the insurances covers as well. The standard is go every 6 months for your checkups and cleaning. I hope that answered most of your questions. Thank you for watching this video, and stay tuned for the next video with the new topic.